Do you have hip extension pain that keeps you from your daily activities and everyday life? Well, today we're going to discuss different techniques to help you with any problems. We're going to go over passive range of motion techniques, stretching techniques, resisted exercises, and some joint mobilizations to help you out. To start out, let's identify the primary muscles of hip extension. There's gluteus maximus, the long head of the bicep femoris, semitendinosus, semimembranosus, and the posterior head of adductor magnus. Secondary hip extensor muscles include the posterior fibers of gluteus medius and the anterior fibers of adductor magnus. When the hip is flexed past 70 degrees, all of the adductor muscles, with the exception of pectineus, assist with hip extension as well. Let's begin with a passive range of motion technique for hip extension. The positioning should be prone and the stabilization should be the ischial tuberosity. Here's the passive range of motion technique as discussed earlier. Here you see the patient lying and prone and the therapist grabbing the legs and stabilizing at the ischial tuberosity. This technique can be repeated 3 to 5 times to increase range of motion. In order to increase hip extension, a joint mobilization technique that can be applied is the anterior hip glide. The positioning for this mobilization technique would be the patient would be laying and prone with their lower extremities off the end of the table. A belt would be placed around the therapist's shoulder and around the patient's front distal thigh. The therapist would then apply their force through their proximal hands in an anterior direction by flexing at the knee using their body weight. Here is the anterior hip glide joint mobilization technique. There are different grades according to the Maitland technique that can be used. Grade 1 and 2 are primarily used for pain reduction, and grade 3 and 4 are primarily used to increase range of motion. Depending on why you're seeing your patient, different grades can be used. Because there is a lack of hip extension range of motion, the muscles we would like to stretch are the quadricep muscles in order to increase the mobility of hip extension. The position for this stretch, the patient will be in prone. They'll be pulling their heels towards their glutes, and they can use the band to help assist in this stretching technique. For the fit principles for stretching the quadricep muscles, the frequency will be 2 to 5 repetitions. The intensity, you want to hold the position until you feel a stretch in the quad, but there should be no discomfort or pain. The timing should be 20 to 30 seconds, and the type is a static stretch with the use of a band. Alrighty everyone, it's time to grab your handy dandy yoga straps so we can stretch those quad muscles out. As described earlier, here is our quadricep stretch with the patient laying and prone. I've just handed her the yoga strap so she can stretch her muscle herself. But wait, there's more. Don't you leave yet, there's still resisted exercises to come. As described earlier, gluteus maximus is a primary hip extensor muscle. In order to strengthen this, an easy exercise that can be done are glute kickbacks with ankle weights. The position for this exercise, the patient will be on their knees and their palms with ankle weights around their ankles. To perform this exercise, the patient will lift their foot and push their heel up towards the ceiling, focusing on squeezing the glutes. The fit principles for this resisted exercise that focuses on strengthening gluteus maximus is as follows. The frequency is 8 to 12 repetitions with 2 to 3 sets performed. In between those sets, there should be about 2 to 3 minutes of rest. This exercise should be performed 2 to 4 times per week with about a day's rest in between. The intensity is 60 to 80% of a 1 rep max. The time, it should be a controlled, smooth movement while maintaining good form. The type of exercise is a dynamic movement with constant resistance applied. As you can see here, the patient is in position. The therapist is just showing the exercise, and the patient will repeat. There you have it. Now that you have your hip extension restored, let's get back to your everyday life. Thank you so much for watching.